So today we're going to be going over Medicare, including all of the options. So for people that are just about to retire, Medicare is the health insurance program that's available for people age 65 and older. Also for people who are under 65 with certain disabilities, such as ALS, without a waiting period, and also for end-stage renal disease. For those people who are under 65 with other disabilities not like those, there is a 24-month waiting period before you would qualify for Medicare. And also to get Medicare, you must be a U.S. citizen or lawfully present in the U.S., and you must reside in the U.S. for 5 continuous years. So the agencies that are responsible for Medicare include Social Security, which is where you go to enroll in Medicare Part A and B. So typically when you're retiring and you want to start Medicare, that is your first step, is to contact Social Security to set up Part A and B. If you are a federal employee or retiree, it would be the Office of Personnel Management. And if you are a spouse or a railroad retiree, it would be the Railroad Retirement Board. And then the main regulatory agency for Medicare is the Centers for Medicare and Medicaid Services, also known as CMS. So the parts of Medicare are Part A. Part A is the first part, and that is, hold on one second here, I'm just having a bit of a problem with my screen. Here we go. Okay, so Part A is hospital insurance, and that also covers other things, which we will get into. Part B is medical insurance, and Part D is your drug coverage, and Part D is usually offered by private insurance companies with a contract through Medicare. So your options, these are the different Medicare options that are available to you. When you first enroll in Medicare and also during certain times of the year, you can choose how to get your Medicare coverage. There are 2 main ways to get Medicare: Original Medicare and Medicare Advantage, also known as Part C. Original Medicare coverage includes Part A and Part B. Also, if you want or usually need drug coverage, you can join a separate Medicare drug plan to get Medicare drug coverage, also known as Part D, like dog. You can use any doctor or hospital that takes Medicare anywhere in the US. And to help pay your out-of-pocket costs in original Medicare, such as your 20% coinsurance, you can also shop for and buy supplemental coverage, which includes supplemental coverage like Medigap. Or you can use coverage from a former employer, union, or if you qualify, Medicaid. Just one note, Medigap policies only work with original Medicare. If you choose the option of Medicare Advantage, you cannot also have a Medigap policy. So enrollment in Medicare Part A and B. Enrollment is automatic for people who already get Social Security benefits. So if you are receiving Social Security retirement benefits when you turn 65, or if you are under 65 and have a disability and are already receiving disability benefits for 24 months, you will automatically be enrolled in Social Security, usually about 2 months or so before you actually turn 65 or hit the 24-month mark. Also, if you receive railroad retirement benefits, you will be automatically enrolled in Social Security at the time you turn 65. When enrollment is not automatic, you have to contact Social Security to set up your Part A and B. You can do this up to 3 months prior to turning 65. So for instance, if your birthday is, let's just use the month of October, if you turn 65 in the month of October, you can start contacting Social Security in the month of July to set up your Part A and B. If you were retired from the railroad, you would contact the Railroad Retirement Board to enroll. Note, the current age for Social Security retirement benefits is age 62. However, Medicare eligibility age is still 65. So this is a copy, like an example of what your Medicare card will look like when you get it. It shows the type of Medicare coverage that you have. So it will say Part A and or Part B. It's like if you are in original Medicare when you decide to like go to your doctor or any other provider, you use your red, white, and blue card to get services. If you join a Medicare Advantage plan, your plan will give you a card to use when you get healthcare services and supplies. Your Medicare Advantage plan ID card is your main card for Medicare. However, you might also be asked to show your Medicare card to prove that you have Medicare as well. So you should always carry both cards with you. The Medicare card shows the type of Medicare coverage, and it will also have the date that your coverage started. If you get your Medicare card and you don't want Part B, which will go over the situations where you might not want to take Part B, you would follow the directions that are included and return the card back to Social Security, and then Medicare will send you a new card that shows that you only have Part A coverage. If you need a replacement card, you can do that two ways. You can either go to medicare.gov/account to log into your secure Medicare account and print an official copy, or you can call 1-800-MEDICARE to have them resend out a copy of your Medicare card. And currently, we are recommending, because this is going to be a big push through both Social Security and Medicare in the next year or two, for people to sign up for their Medicare account. It's called a My Medicare account, and they are recommending that people start doing that right away because it helps show all of the coverage that you have in one place. You can order your own Medicare card. You can also see all of the medications that you most recently filled. So it's an easy way, like if you need to look at your Part D plan, to have all of your medications right there in front of you and not have to worry about either looking at the bottles or finding a list from your pharmacy. They are kind of going to this because it's going to streamline and make things more personal. Like if you need to, like for instance, contact us during open enrollment to look at what your options are for the next year. So when you can enroll in Medicare, you can first sign up for Part A and or Part B during your initial enrollment period. This is the 7-month period that begins 3 months before the month you turn 65, and it ends 3 months after the month you turn 65. So for instance, like that same scenario, if you turn 65 in October, your initial enrollment period will be all the way from July all the way through January. If you sign up for Part A and or Part B during the first 3 months of your initial enrollment period, in most cases, your coverage begins the first day of your birthday month. However, if your birthday is on the first day of the month, your coverage will start the first day of the month prior. So again, like if, for instance, if your birthday were October 1st, you would actually be eligible for coverage starting September 1st. If you enroll in Part A and or Part B the month you turn 65 or during the last 3 months of your initial enrollment period, the start date for your coverage will begin the next month. So for instance, like I said, if you turn 65 in October and you don't actually enroll in your Medicare benefits until October, it will start November 1st. If you're eligible for premium-free Part A, you can enroll in Part A once your initial enrollment period begins and any month afterward. If you have to buy Part A, you can only sign up during a valid enrollment period. If you don't enroll in Part B or Part A, if you have to buy it during your initial enrollment period, you may have to pay a late enrollment penalty. For Part B, that would be a lifetime penalty, which we can go over that. Your 6-month Medigap original enrollment period starts when you're both 65 and have Part B. So that's the caveat. So if, for instance, you're still working when you're 65 and you still have coverage through a creditable employer, which is typically an employer that has at least 25 employees, which obviously the North Dakota State employees would qualify for that. If you're still 65 at that time and you're still working and have coverage, you don't have to take Medicare Part B. You can defer that until you retire and no longer have active coverage through your employer. So then that gives you a 6-month window from that time to sign up for Medigap. So if you already have Medicare and want to change how you get your coverage, there are a couple different ways to do that. So the most common one is the open enrollment period, which we are about to start, which starts October 15th and runs through December 7th every year. At that time, you can make changes to both your Part D plans, and if you're on it, you can change to a Medicare Advantage plan, or you can choose to go from original Medicare and or your Medigap plan to a Medicare Advantage plan. All of those plans, when you make those changes during that time period, will have your new plan start as of January 1st. There is also a second enrollment period for Medicare Advantage plans. That is specifically for people who already have a Medicare Advantage plan. So if you have a Medicare Advantage plan and you want to make changes to it, you can also do that January 1st through March 31st of every year. And then that plan will start the beginning of the following month. The other period is a special enrollment period that would have special circumstances that would allow you to enroll outside of the two open enrollment periods. For instance, like I said, if you retire, if you're still after 65 and you're still working and you retire at any time during the year, that will trigger a special enrollment period to choose Medicare Part B, your Part D prescription plan, and also choose whether or not you want Medigap or a Medicare Advantage plan. That also includes if you move to a different area, even if you move to a different county within the state of North Dakota, you still have to look at possibly changing your plan, especially Medicare Advantage plans, because those are very specific to the county that you live in. Also, you might have to change your Part D prescription plan. And most definitely, if you move to a different state, you will definitely have to change both your Part D and or your Medicare Advantage plan. A couple of the other situations that trigger that are if you suddenly become eligible for Medicaid, the Medicare Savings Program, or Extra Help, that will give you a special enrollment period, and we will go over those, what the qualifications are for those programs a little bit later here. Or if you change status, such as if you are become a resident in an assisted living facility or a nursing home, that also gives you a special enrollment period. So Part A, which is hospital insurance, it also covers other things. Part A will cover inpatient care in the hospital. It will also cover inpatient care in a skilled nursing facility after a related 3-day inpatient hospital stay. So for those that are not familiar, skilled nursing facility are like facilities where you go for basically rehab care or to regain strength and or abilities after either an injury, surgery, sometimes after a stroke or a heart attack if you need therapy to help you get back to where you were before. It also covers blood, like if you have to have blood transfusions while you're inpatient in the hospital. It covers hospice care, and it will cover home health care. So for what you pay for original Medicare, this is for 2024. It is predicted that this will change a little bit for 2025. So for the hospital inpatient stay, if you were just to have original Medicare and nothing else like Medicare Advantage or Medigap, for each benefit period, which is each separate inpatient hospital stay, you would have a $1,632 deductible. And then after that, for days 1 through 60, you would pay a $0 coinsurance for each benefit period, days 1 through 60. For days 61 through 90, you would have a $408 coinsurance per day for each benefit period. And then for days 91 and beyond, it would be an $816 coinsurance per each lifetime reserve day after day 90 for each benefit period. And the caveat for that is that after day 90 of what your one inpatient stay, you do have lifetime reserve days of up to 60 days. So you have an additional 60 days over the course of your lifetime. Beyond the lifetime reserve days, you would have to pay all costs. Note for if you do pay for private duty nursing, if the hospital charges for a television or a phone in your room, or if your facility has semi-private rooms and instead you have a private room, you would potentially have to pay the difference between the cost of those. Although in North Dakota, that's not as common because a lot of the facilities in North Dakota are just automatically have private rooms and not semi-private. For skilled nursing facility, That would be for days 1 through 20. You pay $0 for each of the benefit periods for days 1 through 20. And then days 21 through 100, you would pay a $204 coinsurance per day for each benefit period. And then days 101 and beyond, you would pay all costs. For home health care, you pay $0 for home health care services. However, if they have you get any kind of durable medical equipment or supplies while they're giving you home health care services, you would pay 20% of the Medicare approved amount for those. For hospice care, you pay $0 for hospice care services. However, you might have a copay of no more than $5 for each prescription drug and/or other similar products for pain relief and symptom control while you're at home. In rare case that your drug isn't covered by the hospice benefit, your hospice provider would contact your Medicare Part D prescription plan to see if it's covered under that plan instead. You might need to pay 5% of the Medicare approved amount for inpatient respite care. So that would be at a respite care facility. Medicare does not cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. For blood, if hospital gets it from a blood bank at no charge, then you would have no charge as well. So do you need to sign up for Part A? If you are receiving Social Security or Railroad retirement benefits at least 4 months before you turn 65, you will be automatically enrolled in free Part A. If you don't get Part A automatically, you should consider signing up for Part A when you're first eligible during your initial enrollment period. Most people don't pay a monthly premium for Part A coverage if you or your spouse paid Medicare taxes while working. If you're still working or have coverage through a spouse, talk to your employer benefits coordinator to learn how enrolling in Medicare or delaying enrollment will affect your employer coverage. That basically means that it depends on how your employer coverage or your spouse's employer coordinates with Medicare. Sometimes there's no benefit if you already have coverage through an employer. Sometimes, because of the way they coordinate, it might not be worth it to pay for Part B monthly premium because Medicare might wind up not paying anything. And if your employer, if you have coverage through your employer, typically, as long as that employer has 25 employees, they will always be the primary payer and pay first. One thing to note, you can no longer contribute to an HSA if you have Medicare. You may have to stop contributing to your HSA up to 6 months before your Medicare starts. You can withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses like deductibles, premiums, and copayments. If you contribute to your HSA after you have Medicare, you could be subject to a tax penalty by the IRS. So it kind of depends. Most people, if they know about this ahead of time, they automatically choose to stop paying into their HSA so they don't have to worry about if there are any tax penalties. Otherwise, you could talk to your accountant and/or the person who does your taxes for you to see if the tax penalty would apply if you continue to continue to contribute to your HSA. So for Part B medical insurance, this is medical, which covers most everything else except prescriptions. Part B helps cover medically necessary services such as doctor services, outpatient medical and surgical services and supplies for procedures like x-rays or stitches, clinical laboratory services like blood tests, urinalysis, and other screening tests, durable medical equipment, also called DME, like walkers, wheelchairs, and canes, diabetic testing equipment and supplies like blood sugar, glucose monitors, blood sugar test strips, insulin, insulin is usually under Part D, so that one's slightly different. Lancet devices and LETsets, blood sugar control solutions, and also like some people that are diabetic might need shoes or inserts that can also be covered under Part B. It also covers continuous glucose monitors that some people have. It would cover both the continuous glucose monitor itself and the supplies that you need to maintain that. It also covers preventive services such as like a preventative office exam, certain tests and screenings that are considered preventative, like mammograms, prostate antigen tests and stuff like that. It also can it does include some vaccines, and also certain other things to find or manage a medical problem like flu shots. Some of the vaccines are now covered under Part D prescription plans. For instance, the new shingles vaccine is covered under Part D like dog. Also, the COVID vaccine, the pneumococcal vaccine, those are some of the more common ones that people you get, and those are covered under Part D prescription plan. Part B also covers home health services. You can use your home health benefits under Part A and or Part B, so it kind of depends on how the home health services are set up. Part B pays for home health care if an inpatient hospital stay does not precede the need for home health care, or when the number of Part A covered home health care visits exceeds 100. Medically necessary, it also covers medically necessary outpatient physical and occupational therapy, as well as speech language pathology services. And it does include outpatient mental health care services as well. So for 2024, your Part B monthly premiums are going to be $174.70. We have had information feedback from CMS that said that the projected rate for 2025 would be $185 a month. Your premium may be higher if you did not choose Part B when you first became eligible. The monthly Part B premium will be deducted automatically from your Social Security benefit payment when your coverage starts. If your Social Security benefits aren't enough to cover the whole Part B premium, or you stop getting Social Security benefits, or you choose not to take Social Security benefits when you first start Medicare, you will get a bill for your Part B monthly premium every 3 months. So, like, if you don't have Social Security, they will bill you quarterly. Remember, this premium may be higher if you didn't choose Part B when you first became eligible. The cost of Part B for the late enrollment penalty is 10% for every 12-month period that you could have had Part B but did not take it. In most cases, if you didn't sign up for Part B when you're first eligible, you may have a delay in getting Medicare coverage in the future, in some cases of over a year, especially if it happens to be like right after open enrollment ends. It would basically be almost a year until you would be able to start Medicare again. And you may have to pay a late enrollment penalty for as long as you have Part B. So typically the Part B late enrollment penalty is considered permanent. The only time that is not true is if at some point you qualify for either Medicaid, the Medicare Savings Program, or the Extra Help Program. At which point, if you qualify for those, then the late enrollment penalty will be waived. Individuals with an adjusted gross income on your IRS tax return from 2 years ago previously that is above a certain amount will pay the standard premium amount and what is called an income-related monthly adjustment amount, or otherwise known as IRMA. IRMA is an extra charge added to your premium based on your income level. There are several different levels of IRMA, with the first level starting with incomes at or above $91,000. For 2024 Part B, what you pay for original Medicare. In addition to the premiums, there are other costs you pay in original Medicare for Part B. This is what you pay in 2024 for Part B covered medically necessary services, which are services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. The annual Part B deductible is $240 in 2024. Again, that is expected to go up for 2025. It's expected to go up about $12 to $15 for next year. After you meet the annual deductible, you pay a 20% coinsurance for Part B services. So Medicare will pay 80% and you will pay 20%. Most preventative services have no coinsurance, so you would actually pay nothing for preventative services. If you can't afford to pay these costs, there are programs that may help, and we will discuss this later in the presentation. Do you need to keep or sign up for Part B? If you're already getting Social Security benefits, for example, getting early retirement at least 4 months before you turn 65, like I said earlier, you'll automatically be enrolled in Medicare Part A and Part B without additional application. You'll get your initial enrollment period package, which includes your Medicare card, a Medicare and You book, and other information about 3 months before you turn 65. But the coverage will not start until the first day of the month you turn 65. The Part B premium is usually deducted from monthly Social Security or railroad retirement benefits. The amount depends on your income and when you enroll in Part B. If you delay enrollment, again, you may have to pay a lifetime penalty. People who don't get a retirement payment or whose payment isn't enough to cover the premium will get a bill from Medicare for their Part B premiums. Also, Part B may supplement employer coverage. So again, you would contact your benefits administrator to understand the impact to your employer plan. I can tell you because we do get a lot of calls from people who are ND PERS, and I have done a bit of a training with ND PERS as to what the benefits are that they offer. Typically, most people who have ND PERS that are still employed with their state still have their state insurance coverage through their state employer. They usually don't take Part B because the plan that the state has typically pays better than what Medicare will pay. So having Part B usually will not pay anything above what the state plan that you have through your insurance. So that's why most people don't pay that extra $175 a month, because there really isn't going to be much of a benefit to them as far as getting anything additional paid. If you don't have other coverage, though, declining Part B would mean that you don't have full coverage and could mean that you pay the late enrollment penalty in the future. The first thing that we will talk about that is outside of original Medicare is one of the supplements that you can choose. These are not required. You will not have a late enrollment penalty if you do not choose any of these options. The first one is Medigap. Medigap policy is health insurance sold by private insurance companies that fills gaps in original Medicare coverage. Medigap policies can help pay your share, such as your coinsurance, your copays, or your deductibles of the costs that are left over from Medicare covered services. In all Medigap policies, A through N, if the plan has the same letter, the coverage is standardized, so they can easily be compared. That means that the companies that sell Medigap are all private insurance companies, but they are under federal mandate and contract with CMS. So if they offer a plan, for instance, Plan G, all of the plans that are listed as Plan G are required to have the same benefit, regardless of the monthly premium that they charge. Each company decides which Medigap policies they will sell, so not every company sells every Medigap policy. And then they also determine the price for each plan with state review and approval. So all of the plans that are sold in the state of North Dakota have to get approval, and they have to be licensed in the state of North Dakota by the insurance commissioner's office in order to sell those plans in the state of North Dakota. Each type of Medigap plan offers different benefits. For example, a Plan A will have different coverage from Plan G. North Dakota does recognize the federal rule of guaranteed issue rights for people that are aging into Medicare, which means there is no pre-existing review when you are first eligible for Medicare. However, North Dakota does not require insurance companies to sell Medigap plans to people who are under age 65. So for people who qualify for Medicare due to disability, Medigap plans are not an option until they turn 65. Once they do turn 65, they will have the same guaranteed issue rights and initial enrollment period of any person that turns 65, even if they had original Medicare prior to that. And then maybe to touch more, to give a little bit more clarification on what guaranteed issue rights means. That's the term that means that they aren't required, that they cannot refuse to issue a policy to you based on your medical condition. So they can't have you fill out a medical questionnaire. They can't ask you any medical questions. Regardless of what your medical conditions are, when you're in your initial enrollment period, they have to issue a policy to you. These are kind of a brief overview of the different Medigap plans that are offered in the state. They have quite a few different options. They vary greatly. Plans F and G also include a high deductible plan, which we do have a high deductible plan G in our state. With this option, you must pay for Medicare covered services like coinsurance, copayments, and deductibles up to the high deductible amount of $2,400, $2,490. Before the policy, actually, I take that back. I'm sorry. That's a little bit of a mistake. Currently, for 2024, the high deductible plan is actually $2,800 before they would pay for anything. Plan C and F are no longer available to people who are newly eligible for Medicare on or after the date of January 1st, 2020. So for those of you who are just going to be starting Medicare in the next year or so, Plan F and C are no longer eligible. Plan G is the most similar to Plan F. For plans K and L, after you meet your out-of-pocket yearly limit and your yearly Part B deductible, the Medigap plan pays 100% of covered services for the rest of the calendar year. For Plan N, it pays 100% of the Part B current coinsurance, except for a copayment of up to $20 for some office visits and up to a $50 copayment for emergency room visits that don't result in inpatient admission. So typically for the state of North Dakota, people who choose Medigap plans, the vast majority of people who choose Medigap choose Plan G. It is the most comprehensive of all the plans. I can tell you that for the NDPERS retiree benefit that they offer, it's more of a hybrid Plan F. So it's similar to the Plan F that is no longer available to people that didn't turn 65 in 2020. Plan G is very similar to that. The only difference between Plan F and G is that Plan F covers, you can kind of see on the little grid here, Plan F also covers the Part B annual deductible, which that is the only thing that you would pay out of pocket for on Plan G. So the only out-of-pocket expense you would have on Plan G aside from your premium is that $240 annual deductible. That is expected to go up next year. They haven't disclosed yet how much that's going to go up. Usually it goes up $10 to $15 or so. So I'm not sure yet how much that will go up. The other plan that is besides Plan G that most people choose is Plan N. Honestly, I can tell you, I've never really had anyone even interested when they call us about A through D or K through M. Most people that call us are either interested in G or N. The one other difference about Plan N from G is that it does not cover the Part B excess charges. So what that means is that if the provider does not accept the Medicare allowed amount, which they do have to disclose to you ahead of time that they do not accept Medicare allowed amount, they can charge you up to 15% above the Medicare allowed amount. Plan G covers that amount, but Plan N does not. Also, if you have Plan F, that also covers that amount. So when is the best time to buy a Medigap policy? Usually the best time to buy a Medigap policy is during your Medigap open enrollment period. It begins when you're 65 or older and enrolled in Part B for the first time. You must also have Medicare Part A and Part B to have a Medigap policy. So you have to have both. If you have a 6-month Medigap open enrollment period, I should say you have a 6-month Medigap open enrollment period, which gives you a guaranteed right to buy a Medigap policy regardless of your medical condition. Once this period starts, it cannot be delayed or repeated. So basically what that means is that once you either retire and lose coverage, if you do not have employer coverage, that starts once you turn 65. If you are still working when you're 65, that period will not start until you actually retire and enroll in Part B. So it starts the month that you either turn 65 or the month that you retire and enroll in Part B. During your Medigap open enrollment period, companies cannot refuse to sell you any Medigap policy they offer. They cannot make you wait for coverage, and they cannot charge more because of a past or present health condition. You may want to apply for a Medigap policy before your Medigap open enrollment period starts if your current health insurance coverage ends the month you become eligible for Medicare or the month you reach 65 in order to have continuous coverage without any break. So typically if you want, let's say you're no longer going to have your employment coverage, like your employer plan as of October 1st, you would want to sign up for the Medigap policy prior to that so you have that in place to start on October 1st and you don't have any gaps in coverage. You can also buy a Medigap policy whenever a company agrees to sell you one. However, there may be restrictions such as medical underwriting or a waiting period for pre-existing conditions when you are outside of your initial enrollment period. So what that means is that Medigap does not have a specific open enrollment period each year. If the like you can basically apply for one anytime during the year, as long as the company agrees to sell you one that like you don't have an issue. The problem comes in is that if you're outside of your initial enrollment period, they will have you fill out a medical questionnaire asking you multiple questions about your medical status. Just depending on how you answer that questionnaire, there are some conditions that are automatic denials where they won't even request medical records for. If you have ever been treated for cancer, for instance, if you have certain chronic health conditions like any kind of heart condition, typically also any type like type 1 or type 2 diabetes, usually those are automatic denials where they won't even go any step further. They'll just automatically say you don't qualify. Sometimes they will, like, depending on how you answer questions, they might request your medical records and then decide whether or not they're going to issue a policy or if they're going to charge a waiting period or a higher premium. How to buy a Medigap policy. When buying a Medigap policy, you will want to decide which Medigap plan A through N that has the benefits you need. You can use the Medigap comparison tool on Medicare.gov to compare plans, or by calling 1-800-Medicare. You can also contact us at the SHIP program. We do have a listing that's actually more detailed than the one that's available on Medicare.gov. That includes additional market analytics that help you look at what projected costs would be like as you get older, what their ratings are, how long they've been on the marketplace, things like that. So we also do have that information available for people. You can, oh yeah, it does say, so for insurance companies that sell Medigap policies in the state, you can contact us at SHIP. Our toll-free number is 888-575-6611. You can also call the insurance company directly and shop around for the best plan at a price that you can afford before making a final decision and applying. That, I can honestly say, is probably the least likely option or the last option you would want to choose, just because it can be frustrating to find some of the plans that are sold in North Dakota don't have very many agents that actually sell them in the state, even though they're with big companies like, for instance, State Farm, not State Farm, Mutual of Omaha and Allstate they're large insurance companies, which I'm sure most of you have heard of, but they don't have a lot of agents specifically in North Dakota that sell them, so it's hard to find an actual agent. So that's why either calling us or Medicare or going to the Medicare.gov would be your best bet for that. The next step would be to apply for the policy when you decide which one you want. So the next scenario will be Medicare Advantage plans or Part C. A Medicare Advantage plan is another way to get your Medicare coverage. They are offered by Medicare-approved private insurance companies that must follow rules set by Medicare, or specifically CMS. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A and your Part B coverage from the Medicare Advantage plan, not original Medicare. In most cases, you'll need to use healthcare providers who participate in the plan's network. However, most plans will also offer out-of-network coverage. Caveat to this that I have to fully disclose is that some plans do have out-of-network coverage. Typically, you have better benefits if you do use an in-network provider. One caveat to that has become an issue in the state of North Dakota is the Medicare Advantage plan that is sold by Humana. Humana sells a Medicare Advantage plan in almost every county in the state. However, in a lot of the areas of the state, like a lot of the major providers are choosing as of January 1st of next year, not to accept Humana, which means it's not only that they are not Medicare, that they're not in network, they are choosing not to accept the plan at all. So if you have a Humana plan and you have one of those providers, they most likely will require you to self-pay for the service at the time and then build the Medicare Advantage, like the Humana plan yourself. So for instance, the big ones that we have heard of so far are any Sanford location in the state and any Essentia location across the state. We haven't heard about, for instance, Trinity or Altru or CHI has not said anything yet. The other one is United Healthcare. Essentia has also announced as of January 1st that they will no longer accept United Healthcare plans. So that is something to keep in mind when you choose, like if you decide to go with the Medicare Advantage option, on what plan that you're going to choose. If you join a Medicare Advantage plan, you must live in their service area, typically determined by which county you reside in. So yes, I mean, some of the Medicare Advantage plans are offered in every county in the state. Some are not, especially in the more rural counties. Some have very limited options. So if you move from one county to another, you need to make sure that that plan is still available in that county, or you would have to change plans. You are still in Medicare, so you have all the rights and protections that Medicare offers, even to people that have original Medicare. You still get those services covered by Part A and Part B, but the Medicare Advantage plan covers those services instead. You must have both Medicare Part A and Part B to sign up for a Medicare Advantage plan. You cannot be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility. You may choose a plan that includes prescription drug coverage. Um, the caveat to that is that most of the Medicare Advantage plans offered in our state do already include a Part D prescription plan. The only ones that are not is cost plans, which we'll talk about, that are slightly different. Also, for some people who have TRICARE or VA benefits, you can choose whether or not you want to include a Part D prescription plan because you already have coverage for your prescriptions. If you do not choose a Medicare Advantage plan that includes a Part D prescription plan, you would not have Part D coverage unless you had one of those other benefits like TRICARE or VA. You may also choose a plan that includes extra benefits such as vision, dental, or hearing. At the plan's expense. Those types of services are not covered by original Medicare. And then the benefits and cost sharing may be different. You may have a yearly limit on your out-of-pocket expenses. And typically for Medicare Advantage plans, you would have various different copays for the different services that you have. So when you can enroll in Medicare Advantage plans, if you have both Part A and enroll in Part B during your general enrollment period, you can enroll in a Medicare Advantage plan from April 1st through June 30th, and then coverage would begin the following month after you enroll. If you are new to Medicare and enroll in a Medicare Advantage plan at that time, you can change your Medicare Advantage plan within the first 3 months that you have Medicare. And then you can also make a change to your Medicare Advantage plan during the normal open enrollment period in the fall of October 15th through December 7th, and then again January 1st through March 31st, and then coverage would begin the first of the month after. And that would be also if you change your mind about what Medicare Advantage plan you have or anything like that. If you change your plan during the open enrollment period in the fall, coverage would begin on January 1st. And then you could also still qualify for one of the special enrollment periods that I mentioned previously. Those would still apply for Medicare Advantage as well. So how do you enroll in a Medicare Advantage plan? You can do this a couple ways. You can go to the medicare.gov/plan compare, or you can go just to medicare.gov and choose the option that says find health and drug plans, and you can compare all of the Medicare Advantage plans that are available in your area. You can also visit the plan's website to see if you can join online. Usually if you go to medicare.gov, there is a button there directly to sit like that says enroll, where you can enroll right there on the medicare.gov website. You can call the plan you want to enjoy or to join and obtain the plan's contact information from the plan finder on medicare.gov, or you can call 1-800-Medicare. Also, you can contact us. We can help you look at your options and give you information on contact info for the specific plans. Also, like some people that are interested in vision, dental, and hearing, they don't release the coverage. Those are typically have a max dollar amount that they pay for every year. They don't release them publicly, but if you call them directly, they will tell you what those are. Note, Medicare plans are not allowed to call you to enroll in a plan unless you specifically ask to be called. Like if you go online and you give them your phone number or your email information, they can contact you that way, but they can't just cold call you out of nowhere without having contacted them previously. Also, the plan should never ask you for financial information, including your credit card or bank account numbers over the phone, because if you do sign up for a Medicare Advantage plan, you can choose how you want to have the premium deducted, either from your Social Security or from a bank account. If you choose your bank account, though, they will send you a form in the mail to fill out and then send back. So do not give your personal information like that over the phone when you first enroll. Other health plans, this is the one that I was talking about, Medicare cost plans. These are available still in most counties in the state. There are 4 counties that no longer have Medicare cost plans. They are Burleigh and Morton County, Stutsman County, which is the Jamestown area, and Grand Forks County. These are other types of Medicare health plans that provide Part A and Part B. And then others might just provide Part B. Typically in North Dakota, they provide just Part A and B. There aren't really any ones that are just Part B. In addition, they also can include Medicare drug coverage. These plans have the same rules as Medicare Advantage plans. Medicare cost plans are a type of Medicare health plan that's available in certain limited areas. You can join if you only have Part B. If you have Part A and Part B and go to a non-network provider, the services are covered under Original Medicare. So it's kind of a hybrid where like they will cover most of your services, but sometimes it will revert to Original Medicare. You'll pay the Part A and Part B coinsurance and deductibles. You can join anytime the cost plan is accepting new members, so there is not a specific open enrollment period for that. And you can leave anytime and return to Original Medicare. You can also get your Medicare drug coverage from that specific cost plan if they offer it, or you can choose a standalone Medicare Part D plan. Medicare drug coverage, this is the Part D prescription plans. This is it's an optional benefit available to all people with Medicare. If you choose Original Medicare and you want prescription drug coverage, you must choose and join a Medicare prescription drug plan. You usually pay a monthly premium for the drug plan, which they vary greatly. The plans are run by private companies that contract with Medicare and are provided through Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage. You can also get Part D coverage through other Medicare health plans such as cost plans. So one caveat is that it says that it's an optional benefit, but in reality, it's not necessarily an optional benefit if you don't have other insurance that will cover your prescriptions, such as an employer plan or TRICARE or VA, because if you don't choose a Part D plan when you're first eligible, which I actually just had a situation where a person has been on Medicare a couple days ago, she called and she has been on Medicare for almost 20 years and has never had a Part D prescription plan. And she did not have any other coverage for prescriptions during that time period. If you do not choose a Part D plan and you have no other coverage after you turn 65, you will have a late enrollment penalty, which is currently 1% of the national average for every month that you did not have coverage and were eligible. So the national average the 1% comes out to be just shy of 35 cents a month. So it's pretty low starting out if you only go a year, maybe even 2 years. But for instance, this lady who had almost 20 years of without coverage, her late enrollment penalty was about $80 a month extra on top of what her normal monthly premium is. And that again would be permanent unless you qualify for one of the assistance programs. Let's see. So Medicare contracts with private insurance companies that offer prescription drug plans to people with Medicare. Everyone with Medicare can get Medicare prescription drug coverage by enrolling in a drug plan. Like I said, if you join late, you may pay a penalty. Each plan has a formulary or a list of the covered medications that they prefer. The formulary for each plan must include a range of drugs in the most commonly prescribed categories. So all Medicare drug plans must cover at least 2 drugs in each category of drugs, but plans can also choose which specific drugs are covered in each category. Costs vary depending on the plan. Most people will pay a monthly premium for Medicare prescription drug coverage. You'll also pay a share of the cost of your prescriptions, usually copays, but also some of them have an annual deductible and/or coinsurance. If you have Medicare prescription drug coverage and a higher yearly income, you might also have the Part D IRMA amount again. That would be like if you had Part D IRMA or IRMA for your Part B, you usually will also have IRMA for your Part D prescription plan. If you get a bill for Part D IRMA, you pay this amount to Medicare, not your Part D plan. People with limited income and resources may be able to get what's called Extra Help, which is a program to help pay for their Medicare drug plan costs. So this is the Part D late enrollment penalty. which I kind of went over. So the Part D open enrollment period is slightly different. The Part D, you have to choose a Medicare drug plan when you first become eligible, and that would be you have to enroll within 63 days of your initial enrollment period. So it's not as long as the other plans. It's 63 days from your initial enrollment period start date. If you had other creditable drug coverage or if you qualify for extra help, you will not have to pay a late enrollment penalty. The cost of the late enrollment penalty will depend on the length of time. And Medicare calculates that. We did go over that. And then again, this is the same where you have your initial enrollment period of 7 months, but you have to start 3 months before the month you turn 65. You can do that. And you can choose to switch your Part D prescription plan every year during open enrollment in October through December, and then it will start as of January 1st. And then if you have a Medicare Advantage plan that includes Part D, you can also do it during the Medicare Advantage open enrollment period, and if you qualify for a special enrollment period. You can compare plans again by the Medicare.gov website, calling us at the North Dakota SHIP program, or calling 1-800-MEDICARE. And that is the same places that you will use to enroll. You can also enroll directly in the plan on the Medicare.gov website. These are the programs that you could possibly qualify for. These are for people who qualify based on limited income and resources. They include the Medicare Savings Program, Extra Help, and Medicaid. You should apply for these programs if you have limited income and or resources, or if you have medical expenses that exceed your available income and resources. Even if you aren't sure if you qualify, you should apply anyway. The Medicare Savings Program provides help from the state paying for Medicare costs, including the premiums, the Medicare Part A and B premiums, deductibles, co-insurance, and co-payments. It often has higher income and resource guidelines than regular Medicaid. You can apply for the Medicare Savings Program through the Department of Health and Human Services or your local Medicaid social services office. Extra Help is a program that helps people with limited income and resources for the costs of their Medicare drug coverage. It's also called the Low Income Subsidy. Some people with Medicare must apply for Extra Help. You can apply by filling out a paper application through Social Security, applying online at ssa.gov, or by contacting your local social services office. We also do have paper copies of that available if people need them, and we can send those out. Same thing with Medicare Savings Program. We can send out paper copies for people for that. And then Medicaid, this program helps pay medical costs for people with limited income. It offers benefits not normally covered by Medicare, like nursing home care and personal care services. It is jointly funded by federal and state governments and is administered by the Department of Health and Human Services. So, key points. Medicare is a health insurance program. It does not cover all of your healthcare costs. You do have choices in how you get your coverage, and you do have decisions to make. It's important to know when you need to take action. Your decisions can affect the type of coverage you get, and certain decisions are time sensitive. There are also programs available for people with limited income and resources. North Dakota SHIP program, which is one of the program that I work for, can help people we provide Medicare beneficiaries with free, unbiased information to assist in making an informed decision about your Medicare plan options and coverage. The SHIP staff is comprised of 3 full-time staff, so myself, my coworker, and our supervisor, and we also have 34 volunteer counselors located across the state. Some of them only assist during open enrollment, some are full-time during the entire year. SHIP services are available to North Dakota residents at no cost. The SHIP program is busy year-round, but we do have a noticeable increase during Medicare Part D open enrollment. So coming up right now, we're getting pretty busy. SHIP can also assist you with understanding your paperwork, your bills from Medicare or your Medicare Advantage plan, statements. We can also help with claims or appeals processes if you need to apply, understand a claim or appeal with either Medicare or Medicare Advantage plans. And we also assist people who have long-term care insurance with issues that they have understanding their plan or if they need assistance filing an appeal. And these are some of our resources, which I believe you will have access to these slides to see these and our contact information.